Next, we'll review the final stages of caring for your suicidal patient. All patients will need patient education that is captured as a safety plan. Let's review this in EPIC now. You'll go to your Discharge tab. You can click on your follow-up and instructions for your patient. You also have a smart phrase that you can utilize to help ensure that you're meeting all requirements. This is a personal safety plan that you'll help customize with your patient. It talks about keeping your appointments. You can select items that apply to this patient. You can also keep scrolling down to identify personal warning signs that will help the patient in the future if they're starting to feel like they are feeling currently while in the hospital with you as the nurse caring for this patient. There's some coping strategies identified and protective factors. We can enter support information as free text here. And then having crisis hotline numbers and a plan in place should your patient need this information. This will be printed out in your patient's after visit summary. Now that we've reviewed how to enter the patient safety planning into the discharge after visit summary for the patient, you can also help alert the patient's chart by adding an FYI flag. Let's review this in EPIC. Next to the patient's name, you'll see a flag. You can select the flag and add new flag. I'll type out suicide and select suicide risk safety plan. I'll click accept. This now notifies anyone working in this patient's chart the patient is at risk for suicide. Thank you for taking the time to review this education session. The Joint Commission and CMS are reviewing suicidal ideation and how we care for these patients. This is a top focus for regulatory agencies.
We appreciate your efforts in taking care of this vulnerable population of patients going through very difficult and challenging times. What you do makes a big difference in their lives, and thank you very much.